Welcome to the Choices for Care 804 Forms Process Update. This training is designed for Choices for Care case managers, providers, and service coordinators. This training module is intended to provide you with an overview of the changes to the 804 forms process, including which 804 form must be completed, who completes the form, how it must be completed, and where it must be submitted. This table summarizes the changes to the 804 process. Please note that the form names have changed, several new forms have been created, and in some cases the provider responsible for submitting the form has changed. We will review each of these forms individually. In addition, these forms are now available on the ASD website as fillable PDF forms, and the fax numbers and mailing addresses have been updated. Form 804, Admission to Services. The 804 form is used to report changes in care setting option for Choices for Care applicants who are still pending Medicaid, or to report changes in care setting for active Choices for Care participants. The form is completed by the admitting provider. That would be either the Choices for Care case manager, the Flexible Choices advisor, the authorized agency for adult family care, the enhanced residential care provider, the nursing home, or the hospital social worker. Previously, it was the responsibility of the provider who was discharging the client to complete this form. In many cases, the form was not completed timely, which prevented the new provider from billing for services. The 804 form will now be completed by the provider admitting a program participant to their service. This change allows the provider to bill for services upon admission. When the form is submitted, the long panel for long-term care will be changed in the Access system to reflect the admitting provider name. If your provider name is not in the system as the current provider of service, then you will not be paid when a claim is submitted. To complete Form 804, Admission to Services, begin by entering the individual's name, address, date of birth, and Social Security number. If there is a change in care setting option being reported on this form, check the box of the individual's previous setting. Next, fill out the admission information, including the admission date, the admission service option, the name of the provider of services, and the provider ID number. For home-based and flexible choices only, indicate a case management agency. Fill in the provider name. Finally, fill out the information of the person completing the form. It is important to note that each form must be submitted to the appropriate division or divisions for processing. Form 804, Admission to Services, must be submitted to both DALE and to ADPC. For SAMS users, Form 804 is available as an assessment form within the system. Complete the form, send an alert to the LTCCC, print the form, and send to ADPC. Form 804A, Termination of Services. This form is a new form used to report the termination of Choices for Care services for active Choices for Care participants receiving traditional home-based, ERC, hospital swing bed, nursing facility services, adult family care, or flexible choices. The form is completed by the Choices for Care case manager, the Flexible Choices advisor, the authorized agency for adult family care, the enhanced residential care provider, the nursing home, or the hospital social worker. If an individual terminates services or voluntarily withdraws from CFC, it is the responsibility of the current provider of services to notify the ADPC and the DALE LTCCC nurse. To complete 804A, Termination of Services, begin by entering the individual's name, address, date of birth, and Social Security number. Next, check the box of where the individual is currently receiving services. Then complete the termination information. Fill in the effective date of termination of services. Check the box for the reason for the termination of services. Check the voluntary withdrawal box if the individual is withdrawing services by their choice. The individual must sign the form if voluntarily withdrawing. Finally, complete the name of the person filling out the 804A form and their contact information. Form 804A, Termination of Services, is submitted to both Dale and to ADPC. Again, for SAMS users, forms are available as an assessment form within the system. When the form is complete, send an alert to the LTCCC, print, and send to ADPC. Form 804B, Hospital and Nursing Facility Admissions and Discharges. This form is used by hospitals and nursing facilities to report acute hospital admissions and discharges. The form is also used to report a change in payment source or hospice admission. This form is managed and updated by DEVA and can be found on the Vermont Medicaid website. This form is completed by either the nursing home or the hospital social worker. To complete Form 804B, Hospital and Nursing Facility Admissions and Discharges, again begin by entering the individual's name, date of birth, Social Security number, facility name and provider number, and phone number. Then complete the appropriate section for the individual. Section A is for acute hospital admissions or readmissions or discharges. Section B is for changes in payment source, and Section C is for hospice. Form 804B, Hospital and Nursing Facility Admissions and Discharges, is submitted to ADPC and to DEVA. Their addresses are found on the form and on this slide. Form 804C, Short-Term Vermont Medicaid Only Rehab Stay. This form is used to report short-term Medicaid-only rehab stays. The form is completed by the nursing home or the hospital social worker. The 804C form is used by skilled nursing facilities and hospitals that have swing bed status. This form is used to report short-term Medicaid-only rehab stays. Please use this form if the beneficiary currently has active Medicaid. The Vermont Medicaid Rehab benefit covers stays less than 30 days per episode or 60 days per calendar year following the Department of Vermont Health Access operating procedures. If Medicare is covering part of the stay, you must use Form 804D. To complete Form 804C, Short-Term Vermont Medicaid-Only Rehab Stay, begin by entering the individual's name, date of birth, Social Security number, facility, provider ID number, and phone number. Complete all items in Section B of the form. Finally, enter the information and contact information of the person completing the form. Form 804C, Short-Term Vermont Medicaid-Only Rehab Stay, is submitted to ADPC. Form 804D, Vermont Medicaid, Medicare Stays. This form is used by skilled nursing facilities and hospitals that have swing bed status. This form is used to report dual Medicare-Medicaid rehabilitation stays. Use Form 804D if the beneficiary currently has active Medicare and Medicaid eligibility and is in need of short-term coverage. If the beneficiary does not have Medicare, use Form 804C. This form is completed by the nursing home or the hospital social worker. To complete Form 804D, begin by entering the individual's name, date of birth, Social Security number, facility, provider ID number, and phone number. Complete Section C within 10 days of the need for Medicaid to pay the Medicare copayment and within 10 days after the end of coverage for both Medicare and Medicaid. Form 804D, Vermont Medicaid, Medicare Stays, is submitted to ADPC. If the appropriate 804 form is not submitted to the correct agency promptly, this will affect the payment to the provider of services. See the table below for summary information on how to find the forms and where to submit each form. If you have questions about the forms or how to complete them, you may start at our website, asd.vermont.gov, where the forms and detailed instructions are located. You may also reach out to your local LTCCC or program supervisor for support with filling out the forms. For the forms that are submitted to DEVA and ADPC, the LTCCC may recommend that you contact DEVA for support. To contact the Department of Disabilities, Aging, and Independent Living, call 802-241-2401 or go online at dale.vermont.gov and click Contact Us. To contact the Adult Services Division, call 802-241-0294 or go online at asd.vermont.gov and click Contact Us. Thank you for accessing this training. We welcome your feedback on how to improve this or other trainings available on the ASD website. You may provide feedback via email at colleen.bedard@vermont.gov.